Hi there, my name is Dr. Datesh Daneshwar. I'm a consultant urologist and robotic surgeon with special interest in men's health and urology cancers. I'm from the Gleneagles Medical Center in Kuala Lumpur, and today I would like to talk to you about a very common condition which is underdiagnosed and undertreated in men called chronic prostatitis or chronic pelvic pain syndrome. So chronic pelvic pain syndrome, or known as chronic prostatitis type 3B, is a condition of inflammation which affects the prostate. So when anything affects the prostate, it can affect the way you pass urine or the way you perform sexually. This condition is very common and has been recognized as a major health concern in young men especially, and it also causes significant psychological and emotional problems in men because it is poorly diagnosed and poorly treated most of the time. It affects approximately almost 10% of men at some point in their lives, and most of the time this is non-infective. It is more of an inflammation which we don't know why it actually happens, and that is what makes it quite tricky for us to treat. The symptoms that you may suffer from are pains in your private region, in your perineum, around your anus, maybe at the tip of your penis. You may feel that you have a urine infection, but actually your urine is clear. You will also suffer potentially from sexual side effects, not erectile dysfunction per se, but sexual dysfunction in terms of premature ejaculation, painful ejaculation, and also sometimes the inability to hold the erection long enough to complete the period of intimacy that you desire. Well, I have to say I'm a little biased because I have a special interest in this problem, and I do get quite a bit of referrals from my colleagues regarding this condition. I would easily say that I see at least 20% of my workload in the clinic is actually around chronic pelvic pain syndrome. The problem is this, that when you have a condition which is poorly understood and not easily treated, then it leads to frustration to both the clinician and the patient itself. And it also causes the patient to sometimes have this feeling of guilt, thinking that the problem is related to them or it's because of them doing something wrong. When actually that's not the case. This is a pain problem. There is a reason it happens. The only thing is not easy to identify. And because of that emotional and psychological effect that it may have, it definitely will affect the patient's partner also. Chronic pelvic pain is known to affect the patient in such a way that the people around him too are affected. It may not just be his partner, it may be his family members, it may be his work colleagues, and that can cause a significant social and psychological problem in the patient's life and the people around him. Yes, there is a definite association with erectile dysfunction with chronic prostatitis, but this erectile dysfunction is not what we know as erectile dysfunction because of a vascular or blood circulation problem. The theory behind this is the erectile dysfunction is because of pain, and also maybe because the nerves that control the erections are around the prostate, and those nerves then get affected, affecting on how the patient can sustain a good erection and also have a proper ejaculation. We have guidelines to assist us in this, but to be honest, the treatment for this condition has been very challenging and is challenging for most clinicians. The standard treatment will be to give the patient medications, and we call these medications the 3 A's. An alpha blocker, which is a muscle relaxant for the prostate, an antibiotic because we have extrapolated that most of this condition is related to an infective bacteria, and third is painkillers or analgesia. Now, these treatments do work most of the time, but the problem is most patients will relapse and recur. The other problem is a lot of patients cannot tolerate these medications because they have allergies to certain antibiotics, and those alpha blockers or muscle relaxants can also cause lowering of the blood pressure and giddiness in some patients. So a lot of patients are not happy taking these medications, especially in the long term, and thus it becomes then a hassle and a problem to treat them. There are other physical therapies that have been recognized in the past, such as prostate massages, acupuncture, and physiotherapy. But then again, these treatments are a little bit difficult to find a practitioner who can do them for you. Now, in the recent years, there has been new development with the use of low-intensity shockwave therapy. Now, this is something which is relatively new. It is still not the gold standard for the treatment of prostatitis, but definitely is recognized as an option that a patient can choose to have. I have been practicing this treatment for the last 5 to 6 years with very encouraging results. The best part about the treatment is that it's 100% safe with no reported side effects. The only downside is that the patient has to come a total of 10 times to do it, probably twice a week, and it requires you to spend a little bit of time with me when I do the treatment. But otherwise, it has got no reported side effects, and in my practice, if the diagnosis is correct, the results are very high in terms of how fast you get cured and how satisfied you are with the treatment. And lastly, there is a good chance you will not need to be on long-term medications after that. The bottom line, or the take-home message I'd like to give all of you is that chronic prostatitis is something that does occur. It's a real disease, it's a real problem. Do not ignore your symptoms, do not put them aside. Speak to your doctor, speak to your physician when you see them, discuss this with them. If they are unable to give you an answer, then maybe seek the opinion of a urologist who might be better equipped to help you with this problem. Know that there are treatment options. It's not something that cannot be treated. It can be treated, but it may take some time. You may have to go through certain different steps in the treatment before you get there. But in the long run, by accepting that you have this problem and by accepting that you need some treatment, it will at least give you some peace in your mind that there is not a psychological problem, that this is not something you are imagining. You know that you have it, and then managing it will be so much easier for you and your partner.